Hello, my name is Eric Bricker and I'm the Chief Medical Officer of Compass Professional Health Services. I'm a general internist, primary care physician, and Compass is a healthcare cost containment firm that specializes in tools and support for healthcare consumers. So at Compass, our service centers around a healthcare concierge, which we call our Health Pro, who then assists employees and their family members with things like in-network price transparency, problem bill resolution, quality comparisons. We even schedule appointments and we help close gaps in care as well. And so today we're going to talk about healthcare data analytics. And so healthcare data analytics is a very broad subject, but basically as employers and their broker benefit consultant assess their medical claims, then they want to look and see where their spend is. And so oftentimes there's different ways to slice and dice that medical claims information. So it can be by procedure or diagnosis, it can be inpatient versus outpatient. There's various ways to roll up that data. It's very important not to get lost in the weeds when doing so. So one big way that you want to roll up your claims data, and one way that we do this at Compass, and we literally look at billions of dollars of claims on an annual basis for our clients, but it's very important to roll up your claim spend by diagnosis code or by major diagnosis category. And so when we look at the claims for our hundreds of employers that are clients, we see that in general there are three main diagnosis categories that their claims roll up into as sort of like the major cost categories. Okay, and those cost categories are: 1, musculoskeletal, or MSK for short; 2, cancer; and 3, cardiovascular. And so it's very important to look at just the overall spend in these three categories, because then it gives you an idea of, okay, well, what kind of intelligence can I then bring to my plan design or my interventions? Because you basically want to use the data analytics to then drive an intervention, okay? And so let's talk about then specific interventions for each one of those categories. So 1, for musculoskeletal MSK, first of all, you want to make sure that you're not undercounting that particular type of diagnosis. So oftentimes musculoskeletal is broken out into 2 categories. So there's actual musculoskeletal, and then there's also pain and discomfort. And so it's very important to combine those 2 into one category, just to make sure you're not undercounting the total amount of claim spend in that area. So this is things oftentimes related to orthopedic and orthopedic visits, chiropractors, physical therapists, sometimes neurosurgery as it relates to the spine. Okay, and so here, you want to ask yourself, okay, are there other types of interventions that might be of higher quality and more cost effective for your musculoskeletal claim spend? So for example, is there a type of active tissue release that might be available? Are there really elite specialists when it comes to orthopedics or neurosurgery that you'd want to steer your employees to? Do you want to have your employees getting second opinions for services? Oftentimes a lot of surgical interventions for musculoskeletal problems are not necessary. And so it's very important to potentially have a second diagnosis or second opinion program as well. Okay, so 2, for oncology and cancer, oftentimes employers are not catching cancer early enough in their employees and their family members. And so, money aside, that's just very important for, saving folks' lives, right? And if you want to catch cancer earlier, then you're going to be, more likely and more successful in putting it in remission and having it stay in remission. And so what's the best way to do that is to really ensure that the employees are getting their age-appropriate cancer screening, things in the form of mammograms, colonoscopies, prostate checks, so that you're really catching the cancers in really, stage 1 or 2 as opposed to stage 3 or 4. So we find that when we look at employer claims that their preventive screening rates are actually much lower than they should be. They might have screening rates of only 30% as opposed to 70, 80, 90%. So that's an area of opportunity that we see for a lot of employers in terms of catching those cancers earlier. Okay? And then finally, for the 3rd category, cardiovascular. So there, it's not only age-appropriate screening. So in this case, for cardiovascular issues, that involves things like screening for high blood pressure, high cholesterol, and also high blood sugar, as diabetes is oftentimes related to cardiovascular complications. And so you want to do those screenings for cardiovascular, but then you also want to do what's called secondary prevention, which is for people that already have a cardiovascular diagnosis, i.e. they've had a heart attack or they have diabetes. You want to make sure that they're compliant or adherent with their medication regimens, with getting their appropriate testing. So for example, making sure they're getting their hemoglobin A1C tested every 3 months. And so actually using your claims data to then have interventions in those areas to make sure that their cardiovascular condition is well managed. Because if it's well managed, they can live a long, healthy life and appropriately sort of moderate the symptoms instead of having a catastrophic second heart attack or a stroke or something of that nature. So really, when we're talking about healthcare data analytics, in summary, it's very important to not get lost in the weeds and to kind of roll up your claims spend into diagnosis categories, and then to look at your top 3 diagnosis categories by overall spend, which typically are musculoskeletal cancer and cardiovascular, and then targeting programs around those specific diagnoses. So for more information on healthcare data analytics, you can actually go to our Compass blog, and we'd be happy to provide that information for you. And so really appreciate you watching today. Thank you so much.